At the University Hospitals of Leicester, patient safety is our top priority. For our surgical patients, this means getting it right first time for each and every patient. Our checklists and safety briefings contribute to achieving this. Getting it right is critical, as getting it wrong could possibly result in severe harm or never events such as a wrong site surgery. This video introduces you to the new Safer Surgery checklists. This isn't about ticking boxes, it is about changing the culture in our theatres so that we work together as a team and communicate well to keep our patients safe. This is the new Safer Surgery checklist. Most items will be familiar, however some are different, so be sure to familiarise yourself with the new layout. The new checklist can be identified by the purple stripe running along the bottom. There are 4 versions of the checklist, including a generic one, as well as ones designed for use in obstetric, cardiac, and cataract surgeries. A theatre checklist is completed for each patient going to theatre. The checklist has 5 steps: preparation for surgery, theatre reception check, sign-in, time-out, and sign-out. In addition to these 5 steps, a team safety briefing and debriefing must also be completed for every operating list. The pre-operative briefing is completed at the beginning of the list and is led by the theatre team leader. After the briefing, the first checklist for safer surgery occurs on the ward, with the preparation for surgery checklist, which is completed by the ward nurse. This checklist records the patient's observations and ensures that all of the necessary notes and charts are available. If this checklist is not completed, the patient cannot leave the ward or the theatre arrivals area. When the patient arrives in the theatre reception, staff then complete the theatre reception check. This is an opportunity for the ward nurse to hand over any important issues. The check confirms the patient's identity against their wristband and that they have been consented for the correct operation. It is confirmed that the operative site has been marked and that all of the ward checks have been completed. The patient cannot proceed into the anaesthetic room or theatre until these checks have been completed. Sign-in occurs in the anaesthetic room and requires the anaesthetist, ODP, and a member of the surgical team to confirm the patient's identity and the procedure that they are having against the consent form, site marking, and operating list. The patient should be actively involved in these checks. The sign-in also checks key anaesthetic concerns. The timeout is the final check before surgery commences. All team members must be focused and pay attention to this, as it is the last opportunity to speak up if something isn't right. Intra-operative pauses are also included on this checklist for those surgeries that require them. Before the end of the operation, a sign-out is performed. This is to confirm which operation had been carried out and that the necessary safety checks have been completed before the patient leaves theatre. At the end of the day, the debrief checklist is completed to review how things went and to record any issues as well as any stop-the-line moments. This document is then kept in theatres to serve as a record that can be followed up to check that all necessary actions have been taken.
I take pride in my role in using theatre checklists. I know it's really important for my patient that we get things right. If anything doesn't seem quite right during these checks, I know that I can speak up and stop the line.